At a bill that will require you to have a prescription for some over-the-counter cold medicines.
As Fox 10 News reporter Renee Dials tells us, it's the latest move in the fight against meth makers.
It's not as easy as it used to be to get your hands on some cold medicines. The formerly over-the-counter drugs are now literally behind the counter, and state lawmakers have limited the amount you can buy in a 30-day period. The owner of this drugstore in Mobile says he blocks about 5 sales a month because customers are over their limit. According to the Alabama Drug Task Force, more than 70,000 purchases have been blocked throughout the state since electronic monitoring went into effect in January. But some lawmakers say that's not enough. They're looking at requiring a prescription for medicines that contain pseudoephedrine, the main ingredient in the production of methamphetamine. Senator Ben Brooks says the bill by his colleague Roger Bedford is just another step in the fight against methamphetamine manufacturers.
We have taken a pretty hard line over the last year and a half towards these types of issues, and I would anticipate a lot of support for expanding the penalties and expanding the definition of what sort of acts would violate the law.
Law enforcement officials say the meth manufacturers have found a way around the block sales, and that's why they believe the new legislation is needed.
We've seen thousands of the sales blocked, but we have a situation of unintended consequences, and that is that now people are getting others to go buy it. The methamphetamine manufacturers are getting others and sort of bringing in a new class of criminal, just luring them in to pay them money to buy the cold medicine so that they can use it to make methamphetamine.
Sheriff Sam Cochran says states like Mississippi and Oregon have seen a dramatic drop in meth labs. He says it's because those states require a prescription to buy pseudoephedrine.
The state of Oregon, for instance, has seen as much as a 96% drop in seizures of methamphetamine labs. Our bordering state of Mississippi likewise has seen not as large but a huge decrease in their manufacturing, and in those cases that they are making, ironically, they're finding out that the people manufacturing are making the purchases in Alabama.
Cochran says the same bill failed to make it through the legislature last year. He's hoping it goes through this time.
We'll have to see what happens on the floor, but I think our committee would move the bill pretty quickly.
Senator Brooks says there's a good chance it will.
And again, that was Renee Dials reporting. We're told the regular legislative session will start February 7th.